This segment of DelmarvaLife is sponsored by TidalHealth.
Many of us choose a hotel based on its star rating, but do you ever choose your hospital that way? Why wouldn't you? Fortunately, we have a local hospital that has raised the bar locally and has set new standards on a national level as well.
And when it comes to quality care, they've also been ranked the #2 hospital in the state of Delaware. Their goal to inspire a culture of excellence, compassion, and innovation is only surpassed by what their patients have to say. And we are so happy to be here this afternoon with Penny Short. She is the president of TidalHealth Nanticoke. Penny, welcome to Delmarva
Well, thank you for having me.
Yeah. First of all, congratulations. And can you tell us what it means for TidalHealth to be, TidalHealth Nanticoke to be recognized by CMS as the only 5-star hospital in Delaware, and this is the second year in a row?
Second year.
Wow.
And it's pretty hard to get it one year, but
Right.
to get it in 2 years in a row. So, yeah, it's pretty, I mean, it's kind of prestigious, I would say, because there's 4,600 approximately hospitals that get surveyed or recognized by CMS, and only 290 got the 5-star. So, you know, CMS, that is Medicare and Medicaid, they have lots of data because of all the patients that would be in the hospital that use Medicare and Medicaid. So they're always looking at that information from those patients being in the hospital to sort of look at your quality metrics.
Nice.
So what kind of factors go into determining the 5 stars?
So it's 5 different aspects. So one is mortality. So they look at, just say, somebody coming in with a heart attack or a stroke or pneumonia, and they're looking to see if those patients that were able to survive that hospitalization. So, so certainly important that you want to know that and look at that metrics. Looking at readmissions, so looking at patients with a heart attack, pneumonia, the same ones, heart failure, pulmonary disease, and knee replacement, those patients that returned within 30 days. Because obviously, you know, our goal is to make sure you're caring for them when they're in the hospital, making sure that you're discharging them at the right time, giving them the right outpatient instructions and care so that they don't return. So they're looking at that aspect. Then the safety aspect, which is really important, and that is looking at hospital-acquired infections, because, you know, we do read about that, and that does happen. So they're looking at bloodstream infections that can occur in a hospital. They're looking at surgical site infections and catheter-associated infections. So they're measuring hospitals on all those aspects, as well as patient satisfaction and timeliness and effectiveness of care. So that's the wait times, how many patients left the emergency room after they've signed in but really never got seen because of wait time potentially. They're looking at some patients that come in for a stroke, and did they get their CAT scan within 45 minutes, because that's the best practice standard time frame. And those types of timely metrics, stroke or sepsis care, you know, for severe infections. So all those are important measures that they're looking from a quality aspect. There's a lot in each of those metrics. There's probably, you know, 200 metrics in each of those that they're looking at to measure the hospitals.
So what does it say about the consistency and dedication of the doctors, the nurses, and staff at TidalHealth Nanticoke?
So it really, you know, it really doesn't matter how good you are, right? You're always continually looking to be better. So that really is, you know, our consistent work to make sure that we're wanting to improve. So our staff, and it really takes all levels of the staff, because you think of environmental services, when you're looking at infection prevention, you know, that is a big part of what their work is about. So we have a lot of work with performance improvement. So we have teams in each of the departments that are continually working to make sure they're improving their performance. But it's also about standardization. You know, you think about like the airline industry where it's checklist and you're making sure you're doing the same work the same way every time. And the hospital industry has moved into that over the several years. But for some reason, some organizations have had a hard time shifting to that checklist. But I have to say, within all of TidalHealth, we've done, a very good job of adapting all those best practices to try to stay on top of that.
Sure.
So how does this recognition tie in with TidalHealth's broader view of health care for everyone in the community, in all of our communities?
Well, I'd say the star rating, it really talks about the care when you actually are in the hospital, but for our broader mission really is to keep people healthy. So those with chronic illnesses, really trying to care for them in a way that they're not in the hospital. But when they do need the hospital, it's nice to know that you don't have to be in a large academic hospital. Small communities, you got world-class care right around the corner. So I think that's an important message that I want people to know, that it's right here locally for everyone.
Well, congratulations
Thank
again, and congratulations to everyone at TidalHealth Nanticoke. Thank you so much, Penny Short, for joining us.
Thank you very much
this afternoon.